Hi, guys. All right, so we have chapter 41, the genitourinary and reproductive system function and assessment. Our learning outcomes, we want to explain the normal structures and functions of the reproductive system, identify the effects of aging on the reproductive system, and list data you should collect when caring for a patient with a disorder of the reproductive system. Identify commonly performed tests used to diagnose disorders of the reproductive system and plan the nursing care of patients undergoing each of the diagnostic tests. All right, so here's some review of the normal anatomy and physiology of the women's genitourinary system. It is significantly different than the males. We have the round ligament right here. We have a uterus. We have fallopian tubes and an ovary, the peritoneum. Um, so the vagina, the labia, the urinary bladder. It's kind of review. Um, so again, we have the cervix and the canal, the broad ligaments. When these broad ligaments become deteriorated, that's how the uterus becomes prolapsed. And that's one of the problems that women may suffer from after having multiple births. Um, and it can be quite painful. So that's sometimes you see it in elderly whenever, because sometimes something will be coming out of the vagina and it'll be their uterus. And yeah, it's pretty alarming when you first see it, but once you realize what it is, oh, okay. Typically, these days, they do correct it by going ahead and doing a hysterectomy because it's quite painful. So here's the urethral opening and the clitoris and the vaginal opening. And this is how you're going to landmark how to insert a urinary catheter in a woman. Okay, so here we have the breast tissue, and each breast contains 15 to 20 lobules or lobes, separated by fibrous tissues and adipose tissues. Um, what you need to know is that milk ducts are, even small breasted women can breastfeed because we all have milk ducts. Um, and they don't even feed them plenty. There's no significant less amount depending on the size of your breasts. I know that's alarming for some people to say because they're like, how can you breastfeed? You don't even have. Yes, and you can breastfeed just like a large chested woman. So that is a myth, if you will. But to go over the different parts of the breast, there is the areola. It encircles the nipple. It has sebaceous glands, kind of keeps it lubricated and to avoid dryness and cracking, especially during nursing. All right. And now we have the male genitourinary system. The vas deferens is the tube that takes semen from the testicles to the penis for ejaculation. We have the urinary bladder, the pubic symphysis, which is just the bone above the pubis, and we have urethra. The epididymis is within the testicles, the testes themselves, and the scrotum is the area that holds the testes. So the penis glands is at the end of the penis, um, the sensitive part of the male genitalia, and the ejaculatory duct, and it is also surrounded by the prostate, which is the muscle that pushes out the ejaculation. So the prostate gland sits just below the bladder where it encircles both the urethra and ejaculation duct. It secretes a thin milky fluid into the urethra. Besides adding volume to the semen, the fluid also enhances sperm motility. There's two P-shaped bulbourethral glands as well. Let me see. So review of normal anatomy. There's the two large cylinders um, within the penis. So this is the urethra. This is an arteries, and the corpus cavernosus and the nerves. Dorsal artery is at the top, and the dorsal vein. So the effects of aging on the reproductive system. For women, ovulation and menstruation will stop. So women decrease estrogen secretion. For men, there's decreased testosterone secretion. They have decreased sperm genesis, which means they don't make as many, but that doesn't mean that they aren't able to have children. They could still have children until they're, well, as long as everything's functioning till they're 100, till they die. The problem is that usually they don't move as fast as they used to, if you will. So it doesn't mean that they can't. It just means that um, typically uh, the sperm that live the longest in males are female sperm. They are built for longevity, and they just have more female sperm that survive. So typically, men in their older age have female children. I mean, just a fun fact, but not always. There's still some men, still some little boys that get by. Atrophy of the vaginal epithelium, meaning that it dries out. Um, it's not as elastic. The female vagina, as it gets older, it doesn't have as much as elasticity, and that can cause a lot of pain during sexual intercourse. Men suffer from urinary retention, often due to the hypertrophy of the prostate gland, um, and they are at an increase in bone loss. Probably less than women, because women, we have lack of estrogen, but they're at a risk for fractures as well. So subjective female assessment, you want to ask them if they, what their personal, what their personal cycle, what's normal for them. For instance, because all women are a little bit different. Like, how long does your menstrual cycle normally last? How heavy is it? How light is it? What? And a good way to ask that is like, how many tampons or pads do you go through in an hour or in 2 hours? Or can you use a pad for 4 to 6 hours? That kind of gives us an idea of how heavy the flow is. How are they regular? Are they irregular? Do they not know when their period's going to be? Those are all personal questions, but they're kind of um, customized to the patient, and um, they're really important. Abuse. Do they have any history of abuse? Their menstrual cycle. When was their last monthly period? With the first day of their last menstrual period is the one that we want to know. Obstetrical, do they have any children? That tells us that they are able to have children, number one. Number two, it also tells us history of what we need to, have they had miscarriages? How many miscarriages? They had one child, and then ever since they've had miscarriages, that might be something that needs to be looked into further. Gynecological, meaning, um, are you on birth control? Did When was your last pap smear? Sexual history. Um, do you have multiple sexual partners? Do you, I don't know if knowing how many sexual partners somebody has is significant, other than letting us know that we may need to test them for diseases. But I wouldn't ask in perspective. I'd say, do you have um, multiple sexual. We don't need to know the exact number. You know what I mean? Like, we're going to test you for STDs just to be safe. Family, did, you can definitely tell. I mean, it does depend on why the patient's there, but like your mother, when she started her menstrual cycle, will likely be close to when you're going to start your cycle. And when your mother goes through menopause is likely going to be when you're going to be going through menopause. So anything differentiating from that is not really abnormal, but it's something to mention. Like your family history can correlate a lot with your own cycle. And psychosocial medications and treatments are all things you want to ask for subjective data. So, obstetric history, gravida means the number of pregnancies. So, if somebody's a gravida 5, para 3. That means that they might be pregnant, they had miscarried one, and they had 3 children. So remember, gravida 5, para 3, AB1, and currently pregnant. Got it? Probably not. We'll go over that again when we get to obstetrics, though. Objective female assessment is what is the genitalia like? Um, sometimes they have skin tags, sometimes you see vaginal warts, sometimes you could see tears or visible abuse. What's the vagina like? The uterus and cervix, is it visible? I mean, when we don't really you look at the uterus or cervix, that would be something that the physician looks at. The perineum is the space between the uterus and the anus, and if the woman's had children, it might be smaller, or there might be scarring or things like that to look at. The anus, is there any hemorrhoids? Is there any inflammation? Anything that we need to be significant difference? And the inguinal nodes are the nodes in the inguinal canal. They can palpate, but usually, unless there's a problem, we don't really look at those. So, the clinical breast examination. Um, so, we all do breast self-examination. You should do it every month on your birthday. So, like, my birthday is October 3rd. So, every month on the 3rd, I do a self breast exam. Now, here's the thing is that as your menstrual cycle changes, so do tougher areas in the breast change. Your breast isn't always the same. So, what I've been told is if you feel something like firm, check in a couple of days. Like, check back and say, is it still there? And, usually it's not. So that's just changes of the breast that happen throughout the month that correlate with your menstrual cycle. Um, it's really good to do a clinical breast examination whenever you do a pap smear because it's what it is it's somebody else who has uh, who does this professionally, um, getting an idea of any breast tissue, and they will be able to recognize for sure if something is um, a nodule or a lump more so than you will be able to. Ultrasound and mammography, of course, is that's the key. Is you mammograms every 2 years, like clockwork, from the time you're 40 until 100. That's kind of the standard. Thermography, tomography, MRI, and biopsy if necessary. All right, so your breast self-exam, you usually use like the three, um, 2 or 3 fingers, and you just start from the top and work your way down, back and forth. Um, they say you can go round, or you can go from the nipple out. But I would say most people probably learned the back and forth way to do it. Yes, this is a mammography, and what they do is they take the breast tissue and put it between 2 plates of cold, yeah, 2 cold plates, smash it down flat, and then they take a picture. and they kind of go all the way up into the armpit. I mean, it's not comfortable at all, but it's necessary, and it's not painful. It's just cold, I guess. All right, so the American Cancer Society recommends that screening from ages 40 to 44 are optional for annual screenings, and age 45 to 54 annually. So I was wrong. It's not every 2 years, it's every year. Oh. Um, age 55 and older may switch to every other year or continue annually. So after 55, you can go every other year. But from the time you're 40 to 45 or 54, it's every year. Optional is your BSE, so women should be familiar with how their breasts look and feel. And the MRI and mammogram every year for women at high risk. So if you've had a family member, close family member pass away from breast cancer, you likely want to do that more often. Bone health assessments, they depend on, I mean, we take an age, like if you're in your 60s and you've gone through menopause and you have a low calcium diet and vitamin D, yeah, you're going to be at a higher risk for osteoporosis. But really, the time to build up your bones is not when you're 60. You should be doing and building your stores when you're in your 30s, 20s, and 30s. So that by the time you do get to menopause and you get to that higher age, your bones are strong and can last a little bit longer. But really, how many people drink milk? How many people are big on calcium in their 30s and 20s and 30s? Not many, especially women. Men probably more so, but from my experience, not big milk drinkers. But a bone density test is a dual energy X-ray. It's a DEXA scan, and it kind of just depends on you know treatment, what they're going to do as to what tests they're going to use. So a DEXA test is often used, and they're going to probably see the matrix of the bone, and then how much bone is on the. So yes, she she thinks I'm here to play. All right, stop it, Molly. Oh yes, you're so cute. Okay. And then there's a quantitative computed QCT scan and the peripheral testing. Leave me alone. I'm trying to do my videos. Okay. So additional tests for females are hormone levels, swabs and smears, which is your pap smear, biopsy and cytology, radiography, sonography, thermography, computed tomography or CT scans, MRIs, endoscopies. For the salpingoscopy is a scope going into the fallopian tube. A hysteroscopy is a scope going into the uterus, and a colposcopy and a coloscopy. All right, so for your pelvic exam or pap smear, we're going to prepare the supplies, explain the procedure, have the patient empty their bladder, and assist with positioning. The position they utilize for pap smears is a lithotomy position. It's when they put your feet in stirrups and put your bottom all the way to the edge of the bed, table, whatever you want to call it. And yeah, that's how you're going to be. Just, it's really kind of a vulnerable position, so try to keep the patient as covered as possible. I always have a problem with the rooms that have the patient in a lithotomy position and a door like right there. So, like, hopefully they have a curtain that they can pull to cover the doorway area. It's just, it's quite, it is a vulnerable position, is what I like to call it, I guess. And so here we go. This is the scope. They, um, yep, I forgot what they're called, but They use it's a retractor, it kind of opens up the vaginal area. They have different sizes um, for children versus adults. Hopefully, children don't have to go through this, but some adults have to use a children's size too, especially as the elderly. Um, I don't want to go into details about that, but because of all the atrophy of the skin, it closes up, if you will, and makes it quite painful. Um, they use a smaller retractor. All right, so laparoscopy. Here it is. They're going through the belly button, if you will, to get to. A lot of procedures now for females are done laparoscopically. A laparoscopy is just looking. It's just looking. Sometimes they utilize this um, to diagnose endometriosis, to get biopsies. They use laparoscopic procedures for sterilization. Now they can do it for hysterectomy. So it's kind of cool. They don't have to open you up to do these things anymore, and that decreases the chances for infection. This is a colposcopy. This is going through the vaginal canal and looking and seeing. They make an incision. Here's the vagina, right? Here's the scope. There's the rectum right here. These are the ovaries. They're trying to get um, I don't know what they call it. A cul-de-sac is right here. That's weird. Anyhow, so this is just a way to scope in the vaginal area. This, the only time I've ever seen a colposcope done is if it was to check for vaginal warts or um, lesions, that kind of thing. So the subjective data you want to gather for the male assessment is the history, medication use, family history, personal habits, health promotion, and mental health. The circulatory system, the respiratory system, the GI, musculoskeletal, like, things like do you have any pain in the GI tract, or if when you eat, or what kind of foods do you eat that cause you to have indigestion or things like that. There's the musculoskeletal and the neurological, metabolic, endocrine system. Anything in your history, anything in your family history, and sexual practices. Meaning, do you have multiple partners? Are you married and only have one partner? Are you married and have multiple partners? Those are kinds of the thing we need to know about sexual practice is how vulnerable are you to infection and disease? So that's why we need to know, should we be testing you for everything or should we not be concerned as much? Testicular self-exam, it's usually after the shower, um, and you should be doing it from the time, I think, 13 on, and it should be a downward. You cup one and then you examine the other by using your thumb and forefingers in a downward motion to check for any nodules or lumps. You also need to do a clinical breast exam, and we need to look at the penis glands and shaft, the scrotum, the testes. The spermatic cord is not something we could really see unless they put a scope. The inguinal ring and lymph nodes as well, and then a digital rectal exam that checks the prostate. The diagnostic tests are ultrasound, cystoscopy, and the lab tests like a prostatic specific antigen or a PSA, and a prostatic acid phosphatase, and fertility tests and hormone levels may also be tested. All right, so how would the nurse document reproductive history of a woman who's had 3 pregnancies, 1 set of twins, and 2 abortions? She would be a gravida 3 because she's had 3 pregnancies. A set of twins is only one birth. It's not two births. So it would be number 3. Gravida 3, para 1, AB 2. Yes. According to the American Cancer Society, which women should have mammograms? Only women at risk for breast cancer, all women starting at age 20, women ages 45 to 54 annually, or women age 30 and older every 3 years. The answer is 3. Remember, if you're at high risk, you should be going at from 40 to 45. Which men should do testicular self-exams? All men after puberty, all men after age 21, only men at risk for cancer, only men with a history of cancer. The answer is 1, all men after puberty. What disorders are evaluated with digital rectal examinations? Oh, prostate disorders, penile disorders, colon disorders, or testicular disorders. Remember, a digital rectal exam is checking for prostate disorders. A postmenopausal woman asks if she should take calcium and vitamin D supplements. After advising her to talk with her healthcare provider, what is the best response by the nurse? No, you should get calcium and vitamin D from foods. Yes, you should get 1,200 milligrams of calcium and 600 units of vitamin D supplements daily. You should get your vitamin D from food, but you should consider calcium supplements, or you should reduce your intake of calcium as you age. The correct answer, I believe, is number 2. Be as specific as possible. And yes, they should be taking supplements when you're post menopause. Oh, it's 1 though. I can't go back. I can't go back. So I was wrong. I don't know what it is, but yeah, you should be taking them.